What is the prognosis for autistic adults with schizophrenia? What can we expect for autistic adults who also face schizophrenia? This question touches on the complex relationship between autism spectrum disorder and schizophrenia. Research shows that these two conditions can co-occur, with estimates indicating that between 3.5% to over 50% of autistic adults may develop schizophrenia. One study specifically found that about 7.8% of autistic adults had both conditions. For many, schizophrenia appears a few years after an autism diagnosis. In fact, more than two-thirds of cases develop within the first 3 years. Several factors can increase the risk of this progression. These include age, the presence of depressive disorders, substance use issues, certain personality disorders, and a family history of schizophrenia. When it comes to mental health outcomes, autistic adults with schizophrenia face unique challenges. There is an increased risk of self-harm and suicidal thoughts. Both autistic individuals and those with schizophrenia show higher rates of self-harm compared to the general population. This risk is particularly high among autistic individuals with average to high intelligence and those dealing with depression or substance use. Substance abuse is another concern. Autistic adults are twice as likely to struggle with addiction compared to their neurotypical peers. This complicates treatment and can worsen overall prognosis. Additionally, autistic adults and individuals with schizophrenia are at a higher risk of experiencing violence and victimization, which can further impact their mental health. Psychotic symptoms can also be a challenge. Autistic adults may experience temporary psychotic-like symptoms, often triggered by stress. This can overlap with symptoms of schizophrenia, making diagnosis and treatment more complicated. In terms of treatment, autistic adults with schizophrenia often need tailored approaches that address both their neurodevelopmental and psychotic symptoms. Longitudinal studies suggest that those hospitalized for their first episode of psychosis often continue to need medication 4 years afterward, indicating a chronic course. Practical support for autistic adults with schizophrenia can include early identification of psychotic symptoms following an autism diagnosis, especially within the first 3 years. Integrated treatment plans that address co-occurring conditions like depression and substance use are essential. Additionally, providing support for managing stress and trauma can help reduce the risk of transient psychotic episodes and victimization. Suicide prevention strategies are also critical, given the heightened risks in this population. Overall, the prognosis for autistic adults with schizophrenia involves a sustained need for psychiatric care, with risks amplified by co-occurring mental health challenges and social vulnerabilities. Early intervention and individualized support are key to improving outcomes for these individuals. Understanding the relationship between autism and schizophrenia can help create effective treatment and support systems that respect their unique experiences.